All right, everyone, it's Michael here again. And what we're doing today is we're going to be talking about positioning clients safely. You know, when we're working with a lot of clients, especially at home, we are going to be with them by ourselves most of the time. So, being able to properly position them, we're going to be positioning people, whether they're in a wheelchair and helping them back into the bed, or from the bed to a wheelchair, or from chair to chair, or just assisting them, for example, if we need to be there for them to be able to walk them, to provide assistance when they're walking. We're going to be doing a lot of different things with these clients, and being able to do it safely is the most important key that we need to have. So we're going to be discussing about positioning clients safely. So this particular presentation may take a little bit longer, and we're going to actually have step-by-step explanation on what we need to do to provide the right type of positioning and care for the client. So let's go ahead and get started. So let's talk about positioning as well as the meaning of supine. So positioning literally is the act of helping people into positions that will be comfortable and healthy for them. The next thing is supine. Supine is a position, okay, in which a person will lie flat on his back. So when somebody says they are in a supine position, that means they're laying flat in their back. Lateral would be meaning they are actually positioned on their side, which means they're lying on either side, left or right side. Prone position, if they are positioned in which a person is lying on their stomach or the front side of their body. Okay, now moving on is Fowler Simps. Fowler's is a semi-sitting position in which a person's head and shoulders are elevated about 45 to 60 degrees high. The knees may be flexed and also elevated as well. The Simps position is a position in which a person is lying on his left side with the upper knee flexed and raised towards the chest. Typically, at times, you have a pillow that they are actually using with that. The arm lock or the lock arm position is a position in which a caregiver places his arm under the client's arm, grasping the client's shoulder while the client grasps the caregiver's shoulder. So this is a typical position done when we're assisting a client with any transfers. It makes it a little bit better, and more safety is actually added by using a arm lock or a lock arm positioning. Draw sheets, what they are is they are an extra sheet placed on top of the bottom sheet used for moving clients. Now we're going to be talking a lot of different definitions here, and the reason for that is we're going to be using all these definitions when we are doing the step-by-step positioning and transfer directions for you. Now shearing, on the other hand, is a term where rubbing or a friction which ends up happening results from the skin moving one way and the bone underneath it remaining fixed or moving the opposite direction, okay? So shearing, okay? Log rolling, on the other hand, is a term where moving a person as a unit without disturbing the alignment of the body. Dangle is to sit up with the legs over the side of the bed in order to regain their balance. So here are the basic 5 positions. The supine in the person's back, that is one. Lateral on their side. Prone is in pretty much stomach. A Fowler's position, they are in a 45 degree or a 60 degree angle. In regards for the Simps position, almost similar to the lateral position, okay, but it's more of a mixture between the lateral and the prone positioning, okay? Now, let's talk about supine position. The client lying flat on the back, pillows under head and shoulders, arms and hands as well. The heels should be floating as well for that. Now, lateral position, on the other hand, the client is either lying on either side. Okay, you saw the picture. Pillows support the head, the arms, the legs on upper side and the back, the upper knee on the pillow, the foot on the pillow, pillow between the legs. Now, prone position, the client's lying on their stomach. So a small pillow normally is put under the head and the ankles to keep the feet off the bed. Moving on to Fowler's position, it's a semi-sitting. Head and shoulders elevated, pillows at flex knee, at flex feet, and under the head. For Simps position, it's a variation on the lateral side position, left side lying position. All right. Lower arms behind the back, upper knee flexed, pillow under head, arms flexed, knees and foot. All right. Let's talk about moving a client up in the bed, okay? One of the equipments we need here is a draw sheet, okay? When the client can help you move her up in bed, take the following steps. Remember, anytime you start any procedures, always wash your hands. Explain the procedures to the clients. By us explaining it to them, it makes things a little bit better and they understand and they may be able to help you with certain aspects. Speaking slowly, clearly, and directly to the client. Having that face-to-face contact whenever possible is also great. Provide privacy if the client actually desires it, and they should actually need it. If the bed is adjustable, adjust the bed to a safe working level, usually waist high for you as a caregiver. If the bed is movable, make sure you lock the bed wheels to avoid any additional injuries. Lower the head of the bed to make it flat. Move the pillow to the head of the bed. Now, if the bed has side rails, raise the rail on the far side of the bed as needed. Stand by the bed with your feet shoulders width apart, facing the client, okay? Remember, positioning is very important here because you want to reduce the chances of you having any injuries. You want to be able to place one arm under the client's shoulder blades and the other under the client's thighs. You need to use proper body mechanics, okay? Remember, body mechanics is important. You can ask the client to bend her knees or his knees, brace her feet on the mattress, and push her feet and hands on the count of 3. Remember, communication is very important to talking to the client, okay, to avoid shearing, to avoid any injuries, if they can help you. So on that count of 3, shift your body weight and help move the client while she pushes with her feet. As always, allow the client to do all she or he can for herself, all right? Allowing them to still be an assistance to the care for themselves. It gives them that feeling of independence, the feeling of that they still can do something for themselves. Always help the client into that comfortable position. You want to be able to put the pillow back under the client's head and also arrange the blankets for his or her comfort. Now remember, if you raise an adjustable bed, you always want to make sure you return it to its lowest position. Now if applicable, return the side rails to the position that is ordered on the care plan or the plan of care for the patient. Okay? Always, after any procedures, wash your hands and also document the procedures and observations as needed or as required by your agency or your company. Remember, as you're looking at the photo right here, you want to make sure you watch your proper body mechanics to avoid injuries for yourself, okay? Now, another thing is when you're moving a client up in the bed, but the problem is the client cannot assist you this time. So what happens is, and then there is no one else around to help you move her up in the bed. This is what you do to do the steps. You want to be able to follow the step 1 to 5 on the previous one that we talked about. Then what you're going to do is you're going to stand behind the head of the patient with your feet shoulder width apart and one foot slightly in front of the other, okay? You want to be able to roll and grasp the top edge of that draw sheet, all right? You want to bend those knees, keep your back straight, proper body alignment, okay? You want to rock your weight from the front foot to the back foot in one smooth motion, okay? At the same time while pulling that draw sheet and the client towards the head of the bed. Now, you want to be able to then put the pillow back under the client's head and arrange the blankets for her. Unroll the draw sheets and leave it in place for the next repositioning. Now, if you raise an adjustable bed, remember, return it to its lowest position. Make sure you wash your hands. Also document it as needed or as required by your agency. Now, we're going to talk about turning a client. Because remember, if a client, is bedridden or is immobile, we need to make sure we actually offer proper repositioning to avoid any ulcers, any pressure sores for the particular client. So when we are turning a client, you want to be able to wash your hands. You want to be able to explain the procedure to the client, speaking clearly, slowly, directly, maintaining that face-to-face contact whenever possible. Always don't forget about providing privacy if the client desires it or wants it. If the bed is adjustable, always adjust the bed to that safe working level for you, usually your waist high. Now, if the bed is movable, you make sure you lock the bed wheels. Make sure you lower the head of the bed for the client as well. Now, what you're going to do is you're going to stand on one side of the bed opposite to where you want the client to be turned towards. If the bed has rails, you want to be able to raise the far side rail. Lower the side rail nearest you if it is up, for you. So make sure you lower that down. Now remember, it's, by you turning the client towards is a lot easier than you pulling. That prevents injuries, okay? So what you're going to do is you're going to move the client to the side of the bed nearest you using previous procedures. You want to turn the client away from you. Cross the client's arm over her chest, as you see in the photo. Move the arm one side client is being turned to out of the way. Cross the leg nearest you over the far leg. Then what you're going to do is you're going to stand with your feet shoulders width apart, bend your knees, straighten your back, place one hand on the client's shoulder and place the other hand on the client's nearest hip. Gently push the client onto side as one unit towards the other side of the bed, toward raised saddle rail if present, okay? Now shift your weight from your back leg to your front leg, okay? This is why you have to have one foot a little bit forward than the other. Now, if we are turning a client towards you, on the other hand, you also want to cross the client's arm over her chest. Move arm on the side client is being turned to out of the way. Cross your leg farthest from your other, what you need to do is you want to cross the leg farthest from you, okay? Whatever the leg is farthest from you, you want to cross that leg. You want to stand with feet shoulder width apart, bend your knees, then place one hand on the client's far shoulder, okay? You have to understand, when we're giving care for these clients, sometimes we want to always make sure we're talking to them, we're reassuring them, okay? We want to be able to make sure we reassure them and we actually tell them what's going on. You're going to tell them, for example, just to let you know, I'm going to put my hands on your shoulder right now and I'm going to put my other hands on your hip, okay? And then you can say, I'm gonna then gently roll you towards you, okay? Or towards me. And this is important that when you start actually telling the client what's going to be happening, it's very important because we want to provide great care and we want them to actually know what care is being given. The next step is you want to position the client properly, comfortably, and in good alignment. Remember, proper positioning includes the following: head supported by pillow, shoulder adjusted so client is not lying on the arms, top arm supported by pillow, the back is supported by a supportive device, top knee is flexed, supportive device between legs with the top knee flexed, knee and ankle are also supported. Remember also, towards the end, if it is an adjustable bed and you raise it up, return it to its lowest position. Make sure after you've done all your procedures, you wash your hands, and then also document the procedure and any observations you have made. Moving on now to assisting a client to a sit-up on side of the bed, or also known as dangling. And we talked about that definition early on in this particular slides. Let's talk about dangling is where your lower extremities is dangling on the side of the bed. So also, just once again, every time we are doing a procedure, you want to wash your hands. Always explain the procedures. Always provide the privacy. Remember, if the bed is adjustable, adjust it to a good height for you, a good position. All right? So you want to be able to make sure you adjust that good position. Now remember, the difference between assisting a client up and then just moving a client is the fact that if we're going to be helping the client up and have them sit up, we want the bed to be in its lowest position and not in a position that's easy for us or our hip level, okay? And also make sure that if the bed is movable, they have wheels that you actually lock it to prevent any falls. So what are you going to do next is you're going to raise the head of the bed to a sitting position, okay? You want to be able to fan fold or fold into pleats, okay? Fan fold the top covers of, to the foot of the bed. Ask the client to turn onto his side facing you. Assist as needed, okay? Then you're going to tell the client to reach across his chest with the top arm and place his hand on the edge of the bed near his opposite shoulder. Ask him or her to position down on that hand to raise his shoulders up while swinging his legs over the side of the bed. Next thing always allow the client to do all that he or she can for himself, okay? Self-care, allow them the independence, that they have that feeling that they are actually involved in the care. Now, however, if the client needs assistance, you want to follow these following steps. You want to stand with your legs, shoulders width apart. Once again, proper alignment, You want to make sure you bend your knees, straighten your back. You want to be able to place that one arm of yours under the client's shoulder blades, and then the other arm under the client's thighs. And you're also going to give them the count of 3. You're going to count 1, 2, 3. Okay? The moment you count 1, 2, 3, slowly turn the client into a sitting position with the legs dangling over the side of the bed. The weight of the client's legs hanging down from the bed helps the client to be able to sit up. You're using gravity here, okay? Ask the client to hold on to the edge of the mattress with both hands. Help the client to put on non-skid shoes or slippers. Then have the client dangle as long as ordered. The care plan may direct you to allow the client to dangle for several minutes. What this does, it prevents the client from having postural hypotension. Okay, because sometimes if a person just actually stood up or just sit it up really fast and they decided to stand right away, they may have a postural hypotension where there's that drop in blood pressure that will then cause them to get dizzy, then all of a sudden may cause the client to actually have a fall or possible injury. So remember, when you actually get them up sitting up, you want to be next to them and don't just leave them by themselves. You want to be able to follow that care plan. Do not leave the client alone. So if the client is dizzy, for example, because they had that postural hypotension and they are dizzy for more than a minute, what you want to do now is you want to have them lie right back down again. If it's only for a few seconds, that's perfectly fine, right? But just have them lie back down. Now take the pulse and the respiratory rates and report to your supervisor as needed according to your agency's policy. You then want to remove slippers or shoes, gently assist the client back into bed, place one arm under the client's shoulder and the other arm under the client's knees, slowly swing the client's legs onto the bed. Remember, if you raised an adjustable bed, or you always want to make sure you put it back to its lowest position, okay? Always have a bed to its lowest position. This is actually assists and prevents with the injuries. And once again, after everything that you do, always wash your hands. If there's any dizziness or if there's any shows that the client or the patient is not able to tolerate sitting up for a long period of time, make sure that you actually document and procedure that, okay? If you're a homemaker, a caregiver, a non-medical private duty person, find out what your policy and procedures are and what you need to do if something like this gets, happens to the client. Okay, let's talk about describing how to safely transfer clients. We want to be able to understand that we need to review the principles of proper body mechanics, okay? Alignment, base support, center of gravity, fulcrum, and lever equilibrium is very important, okay? When we are moving clients, we need to think about that base of support. We need to think about that center of gravity. We need to talk about the alignment that you need to have, straighten back, bending your knees, okay? Making sure that we're doing things properly, all right? So when we're transferring clients, to be safe, we have several items that we can have and use when we're doing the transfers. One thing is known as a gait belt or a transfer belt, okay? It's a belt made of canvas or other heavy material used to help people who are weak, unsteady, or uncoordinated to stand, sit, or walk. It pretty much goes around that person's waist and it locks in, so it's easy for us to be able to have something to hold on to. Okay, it just gives that extra support for us, a good positioning for us to be able to hold on to the patient to avoid any additional injuries or falls when we're doing transfers. Now, a slide board, on the other hand, is a wooden board. They also have them made in plastic, but hard ones, that helps transfer people who are unable to bear weight on their legs, also called that transfer board. So slide board, also known as a transfer board. Transfers should always be planned so that the stronger side always moves first, okay? We need to understand these basic guidelines for assisting a client in using a wheelchair. Know how to use the brake and arm rests and the foot rests as well. Always lock the wheelchair before assisting client into or out of it. You want to be able to make sure that you tilt the chair and press down on the seat rails to open up the chair. Lift the center of the seat to close it. You want to release the arm lock to remove the arm rest. Pull the lever and swing footrest out towards the side of the chair. Lift off the footrest to remove them, and then you're going to reattach the footrest. You want to put it back in the side position, swing to the front, and it should lock into place. So next thing you're going to do is you're going to lift or lower the footrest, you want to support the leg or the foot. You want to squeeze the lever and pull up or push down. So there's that lever in the side that you need to make sure you squeeze. Sometimes because of some rust, at times it may be a little bit difficult, so that's where you need to have some maintenance happening for the wheelchairs. You remember, the client must use side of the body that can bear weight and lift side that cannot. Okay, so you want to be able to be supportive on the weak side all the time. All right, your client always must be wearing non-skid footwear before transferring. Always make sure they are wearing footwear and not being barefoot. Okay, you want to assist the client as needed by having the chair close and wheels locked. Making sure you use a transfer belt. Making sure you check for alignment in the chair. All right, and then if you're going to move the client back off chair, what you need to do is stand behind the client with arms under the client's arm. Client pushes, you pull gently, repositioning the client at least every hour to be able to move them back in the chair. Because gravity will work on them sometimes and they kind of will droop forward. Make sure, if need be, use mechanical lift only if trained to do so, okay? Some clients at home will have their own mechanical lift, also known as a Hoyer lift. There's several other companies that makes them. but the most famous one is the Hoyer company. So you're going to be hearing them calling it a Hoyer lift. But this is what we typically call generically wise is a mechanical lift. You want to keep chair or wheelchair close to bed to only move client for short distances. Okay? You want to be able to check sling and straps for tears or fraying. Do not use mechanical lifts, okay, if there are tears or holes in them. Okay, so if when we're talking about the tears and holes, we're talking about in the sling or that pad where they actually are laying on when we do the transfers. Okay, because you never know that if you have something with holes and you do a lift, things can rip and the patient or the client can fall off, and that makes the injury even worse. You always want to make sure that open legs of the stand of the mechanical lift. One good suggestion: if you go to YouTube, you'll see a lot of videos in regards to this. Make sure you watch a video, do a quick search. Mechanical lift or Hoyer lift at home, and you'll see a lot of videos to be able to help you with this. You want to pump up the lift only to the point where the client's body clears the better chair. Some Hoyer lifts or mechanical lifts are pretty much manually pumped to be able to raise them up, just like any jack for a car, for example. Or they also have ones where they're electronic and you can just press a button and things can raise and also lower down as well. Remember, any procedures that you're doing, you need to make sure that you wash your hands before and after, okay? So in this particular one, it's transferring a client from a bed to a wheelchair. Okay, and just read the following procedures and you'll be able to know this. And we truly recommend you guys that you actually make sure that you listen to the videos, and also you can look it up in YouTube. There's a lot of videos that are available out there for transfers, and we truly suggest that to you. We will actually give you some links to some of these videos to make it easier, but you can do a quick search in YouTube and you can actually see a lot of these different things. Make sure when you're doing transfers, always have and make sure you have your transfer belt that is available, okay? So these are just basic procedures, and we want you to be able to make sure you read this. If you even want, what you can do is you can literally press stop and just read it yourself and slowly move forward as you read all these procedures. These are all typical, but always make sure proper safety for the client is literally the most important information here. We need to give safety for the client. If you look to the right, you're going to see a photo. This is a basic photo of what a lift looks like, and what the sling is, where the person actually is. Always make sure that their hands is always crossed when they're inside. You don't want their hands dangling outside when you're doing the transfers, because they can get caught in these lifts, and we don't want that to add additional problems. Always just remember, safety is the most important thing for these particular clients. So transferring is very important to learn. When we're transferring them, be safe for yourself and be safe for your clients as well. Okay? Now, let's go ahead and talk about some more safety points. We call stand-up lifts. Okay, it's used when clients can bear some weight. So it's almost similar to a Hoyer lift, but with the stand-up lifts, the patient can actually help with standing up. And typically, when you're lifting up the patient, you are facing the client, and there's a way where they can put the feet down in front of them. And so these are also important stuff. You can also look at that stuff as well. Make sure that when we're doing these things, watch where the hands are for the clients, because it is important. We don't want them to get stuck. Okay, moving on to how to safely ambulate a client. Let's talk about what ambulation is and what ambulatory is. Ambulation is walking. Ambulatory is capable of walking. So is the patient ambulatory? Yes. Okay, are we doing ambulation therapy with them? Are we actually making sure that we're making them walk? Yes, great. So this is when we're assisting a client to ambulate, to walk, okay? Once again, you're going to be needing gait belts. You're going to need non-skid shoes for a client. Never make them walk barefooted, because that can cause injuries, and also they can also slip and fall. Make sure every time that we actually do any procedure, always wash your hands, explain the procedures, provide the privacy as needed. Make sure the bed is adjusted to the lowest position before we actually stand them up. If we do stand the client up, allow them to wait for a few seconds, making sure that they are not having any postural hypotension or dizziness. Once they actually are given enough rest and they can actually are ready to stand up, you want to be able to make sure that they have non-skid footwear. Always stand in front of the client so they can actually see you. Now, if you're using a gait belt, place a gait belt around the client's waist over the clothing. You're either going to use a buckle, a plastic buckle that slips in, or you're going to have to do a belt-wise where you actually have to make a tighten way, either or. Just make sure you look at the proper instructions and policies and procedures on how to use those gait belts as important. Now, if you're not using any gait belt, you're going to do is place your arms around the client's torso right under the arms, and you can even interlock your fingers or your hands behind the client to be able to have a more solid base that you're doing. Now, always allow your client to do whatever she or he is able to do for him or herself. Now, if that client is not able to stand without help, brace the client's lower extremities, bend your knees. If the client has a weak knee, brace it against your knee, okay? The client close to your center of gravity, tell the client to lean forward, push down on the bed with his hands, and stand on the count of 3. Okay, this is you giving them instructions and seeing if they can actually help. If you look at the photo right now, that's a sample of a gait belt that has a metal buckle. So as you see here, it's strapped on just like a regular belt, whereas the other one is almost like a clip-on that clips to each other to be able to have that seal. Typically, a lot of caregivers, a lot of home health aides, and a lot of agency nurses, or whatever you're doing, wherever you're working, using a gait belt, they prefer the other clip-on because it's easier to remove and it's a lot faster, so it makes working a lot better and easier, okay? So when you start to count, begin the rock. On the count of 3, rock your weight onto your back foot and assist the client to a standing position. So when you're with a gait belt, when you're walking, walk slightly behind and to one side of the client for the full distance. You want to be able to hold onto the gait belt, okay? If the client has a weaker side, always stand on that weak side. Use the hand that is not holding the belt to offer support to the weak side. Ask the client to look forward, okay, not down at the floor during ambulation. Now, if you don't have a gait belt, walk slightly behind and onto the side of the client for the full distance. Support the client's back with your arms. If the client has a weaker side, stand on the weaker side. Always stand on the weaker side. Always help a client up on the weaker side, okay? Use the arm, not on the back, to offer support on the weak side. Ask that client to look forward also and never look down. What you're going to do is you're going to observe the client while they're walking and they're ambulating. You want to observe if they're going to get dizzy, or they're going to get tired, or they're going to get weak, okay? If that starts happening, that's when you have to make sure that you provide a chair easily to be able to assist them. Remembering that after ambulation, removing the gait belt, if used, is always important. You never leave a gait belt on a client the whole day. Return the client to the bed or the chair or make them comfortable. Now remember, if you raise any adjustable bed, return it to its lower position. And you also want to be able to make sure it's a lot easier to lessen the chance of the client getting any injuries by always making sure the bed is lowered. Always make sure you wash your hands after any position that you do, procedures that you actually do, wash those hands. You want to document any procedures that has been given to the client as needed or as ordered by your team. Always remember that if you are helping a visually impaired client walk, be sure to let the person walk beside and slightly behind you. Be sure to warn the client about approaching corners and steps, giving them directions and letting them know what's going on and what they are facing. Now, will a client fall? More likely, there are potential times where a lot of clients will fall. And if we are present to this, we don't want to stop a client from falling. We can assist a client falling, okay? We assist them. Because if you stop a client from falling, that may cause more injuries. So if we're assisting a falling client, widen your stance, bring the client's body close to you, bend your knees, and support the client. Make sure your proper body alignment is being done and being taken care of and being monitored. You want to lower the client to the floor slowly. Drop to the floor yourself if necessary. Do not try to stop that fall. I cannot, strengthen that enough and tell you that do not stop the fall. If there is a fall, call for help. Never ever get a client up. Follow the agency policies and procedures. And the reason why you don't want to get the client up right away is you want to see if there's any injuries first. Now, if the client has a fall at home, that's a different story. You do need to contact your manager or your supervisor, and at the same time follow the procedures necessary. Each facility has their own policy and procedures regarding clients' falls, whether it's a non-medical or private duty or even a skilled nursing home health agency. So make sure that you adhere to the rules and the policy and procedures that is given to you. All right, remember you will need to complete incident report if a client falls, depending of course on what facility or company you work with. All right, moving on to some things. There's C cane. What is a C cane? What it is, it's a straight cane with a curved handle on the top. That's typically what we see as a candy cane, for example. It has that C, top straight curve area. Now, a functional grip cane, on the other hand, it's a cane that has a straight grip handle. Okay, so this is typically where it looks like a number 7 or an upside down L. Okay, a quad cane, on the other hand, is that cane that has those 4 rubber tip feet, and a rectangular base. So literally, if you let go of the cane, it remains standing up compared to a C cane, where it's normally just a normal cane-looking thing that goes straight down and has only one foot. Functional grip cane can be a combination between a quad cane that has a functional grip handle of choice. So let's look at these comfort measures for clients. Is having plenty of pillows. Using positioning devices is important. Giving back rubs is also good to provide comfort. Change positions frequently and maintain body alignment. For giving back rubs, make sure you follow policy and procedures. It depends on the client if it's allowed or not. Now, we're looking into a few more things to be able to help keep a client comfortable. We're going to talk about foot drop and orthotic device orthosis. So when we talk about a foot drop, it's a weakness of the muscles in the feet and the ankles. And what happens is it causes difficulty with the ability to flex the ankles and also at the same time walk normally. Now, an orthotic device or an orthosis is a device that helps support and align a limb and improve its functioning. So if somebody is having a foot drop, symptoms, what we're going to do is we're going to use an orthotic device to be able to support that particular foot or that limb. Now, a lot of positioning devices are available, to make clients more comfortable. Some can be inexpensively made in the client's home. Some has to be purchased and is very expensive. You want to be able to check with your supervisor on the use of positioning devices for each client, especially some items needs doctor's orders. So we need to know what changes to report about the client's comfort and safety. It all depends on your policy and procedures, how the client tolerates positioning, the transferring ambulation. You might have to chart those. Are there any signs of any skin breakdown? Remember, if there's anything going on with the client, we want to keep them comfortable at their home because that's the only way we can remain with our position, our jobs, is keeping them at home safe. But of course, only if they can tolerate and they can handle being at home. But if they will need additional care and additional services, then of course we need to send them out to the hospital or to a skilled nursing facility. We need to be able to change to improve comfort or safety, any changes in their client ability. We need to report any changes or any things that we see that is not normal. So, this particular chapter is pretty short, but has a lot of steps. And so I want you guys to be able to go back in those steps and watch those. When you have time, go look into YouTube. There's a lot of great videos to be able to detailedly show you guys how to be able to do the proper transfers, proper changes in position, log rolling. If you're rolling somebody towards you or away from you, whatever you need to do, there's a lot of videos that is very important that you guys can actually discuss. We will give you guys some links to a couple of videos to make it easier for your search. Once again, thank you so much. And all we want to make sure is that you're trained properly so that you can actually give great care and safe care for the clients.